And today I'm going to teach you how to shake your hips, and yeah, that is a legit thing I teach my patients. So if you like this and you want some more, click subscribe on my YouTube channel. Alright, so back to shaking these hips. Here's the thing, a lot of people, they walk stiff and rigid. They don't even move their bodies. And it's like, yes, I can see this is why you're in pain, and a lot of it. There's also a lot of people that are out there that, you know, they're walking around with their butt sticking out, and that hurts. Every time I make fun of you guys, it hurts. Or they tuck their bum in, and then they're like, yeah, it's still pain. So here's the thing, I'm going to teach you guys how to do it very simply in a passive way that isn't going to hurt you, and you know, sky's the limit on how many times you want to do it, but you don't need to do it that much. All you need is an exercise ball and yeah, and just some space to do it in. So if you're not comfortable being on an exercise ball, I'll include the link for the video I've posted on how to sit on one and how to get comfortable with it, and so we'll go from there. So there's two different ways I'd like to teach my patients how to do pelvic mobilizations seated on the ball. Okay, so we're gonna backtrack first. So when it comes to the hips, I'll turn sideways so you guys can see. So here's the thing with your body. Your hips, we want to have them neutral, okay? So neutral means that it's not sticking out and it's not tucked in. So like, you know, no Steve Urkel and no baby got back, you know, okay? So when you're thinking about the hips, you want to imagine that there's a dial right here, okay? Yeah, you know, the thing that you guys probably don't use, it's a radio dial. So you want to think about that dial and that you're going to turn it, you're going to toggle it one way and the other way. And so what you want to do is be able to, can you push your bum in and out? If you can do that, that's good, because then things are moving, and you'll be able to adjust and make those corrections with your posture. But if you can't do that, you're going to be stuck. So no matter how much you stretch and how much you do things and exercise, it's still not going to be set up properly, because you need to get your body in that position or get to that position. So that's why I'm going to teach you how to do this. So all you need is an exercise ball. So I've got a so the two ways I like to do is I will do kind of anterior posterior and then lateral. So I'll show you the lateral one first. It's kind of it's always kind of cheesy, but it works. So all you're gonna do is sit on the exercise ball, make sure you're sitting up tall, and then what you're gonna do is the movement is gonna come from your hips, okay? So now you gotta learn about where your hips are. So nothing can move here, nothing can move here, just here. So all you're gonna do, keeping your feet planted, you're just going, you can have your hands here if you want, and all you're gonna do is move your hips from side to side. Super easy, super simple. But here's the thing, and patience drives them bonkers, is when I do this stuff all the time and then make it look easy, and it's like, oh, okay. And then they do it and then they're like, I can't move. So try not to do like this, you're gonna fall off, okay? So just, you know, go at a good pace. This is nice to do while watching TV. Nothing wrong with that. You don't have to be at the gym. You can incorporate this into your day. That's not a problem. I'd rather you guys do something than nothing. So just make sure, can you stabilize up here? Can you stabilize here? And can you move your body, work on that body awareness, so you can just get things moving. So you can see I've got one side that moves better than the other, right? No, it doesn't look so good. Okay, so I'll turn sideways so you can see how that looks. Okay. Woo. Yeah, working on those hips, eh? All right, and try back one more time. So all you're gonna do, again, sit up nice and tall. You're gonna have your feet shoulder width apart, so shoulder width, and you're just gonna rock. Now do the best you can. There's no magic number. Do whatever you can handle, and it takes a little bit of time getting used to your body and being comfortable with that, but once you do, you're fine. So that's the first one I'll do. It's a lot easier than the second one. So the second one is a bit tricky in the sense that, so in the previous video I've done, which I include in the description, you want to focus on your tail tucking in and tucking out. So on this one, this is the only time I'm going to let you guys slouch. So turn sideways so you can see better. Okay, so when you're seated 90 degrees, right? 90 degrees, 90 degrees, 90 degrees, what you want to do is you're sitting up tall. and you're gonna have your feet planted where they are. And all you're gonna do is you're gonna tuck your bum in, so you're gonna slouch, but you're gonna move the ball forward. And then what you're gonna do is you're gonna push your butt out as far as you can. So in and out. Now a lot of people, when they start off with this one, they're only gonna be able to go like this, okay? And it takes a while, and it takes a lot of effort to try and get to this point where you can move your body and you're controlling it. This is also an ab workout too, right? We're activating our receptors while we're seated on here. So it's a good workout, right? So can you get that mobility in so you can adjust and move your body as needed? And that's a lot of key things there when you're working out or when you're at a workstation that's not the greatest, okay? So again, it's just sit up tall, okay? Arms just by your side if you want, just relax. So in and out. My hands here if you need to see that way. So out, in, just like so. Good workout. All right guys, so one extra bonus thing I'm gonna add to this is I'm gonna teach you how I slouch, but not. So patients ask like, oh, like, how does your body not get tired or sore or this or that? And the thing is, I can do a lot in a day, but it's based on how I use my body. So when I'm seated on my therapy stool, if I want to lean forward, I don't slouch, I actually hinge at my hips and I topple forward so that way I can rest comfortably and keep my back straight. So whether it's on the exercise ball, a stool, a chair, even the couch, think about how you're moving your body. So all you're gonna do, I'm gonna sit sideways so you can see. So all you're gonna do is you hinge at the hips, topple forward, and that's it. So you just keep your back nice and straight, keep your head and neck in line with your spine, easy peasy, okay? All right guys, hope you learned a lot today and that you get something out of it, okay? So take it easy and until next time.